Welcome again to another episode of Healthline on TVAsia Telugu channel. This is your host Varsha Singh. I bring you the specialist not only from United States, from all over the world. My goal, or this show's goal, is to bring you the health information that you can use in your life to improve your life, get better treatment, and understand that medicine is far and beyond a mysterious science. There are treatments and modalities that you may not know about, which are being used in other parts of the world. So what are we talking about today? Today, it's my great pleasure to bring Dr. Zubin Marolia. Dr. Zubin Marolia is a practitioner in city of Mumbai. But hold on for 1 second. It doesn't limit his practice. He can see patients from all over the world. And you might be thinking, what does Dr. Marolia do? Let's find out in this episode of Healthline, TVAsia Telugu channel. So welcome Dr. Zubin Marolia. And let me say a few words about what Dr. Marolia does. And there is a special connection that we will be talking about in later part of the episode. This is your host Varsha Singh bringing you this unique episode of Healthline today. So Dr. Marolia is a well-renowned homeopathic physician practicing classical homeopathy and integrative medicine in the city of Mumbai since 29 years. Dr. Marolia developed a deep desire to treat challenging medical ailments very early in the medical career. This led him to discover the field of cancer and mistletoe therapy. He then proceeded to Switzerland in 1991, where he trained in the Lukas Klinik, now called as Clinic Arlesheim in mistletoe therapy of cancer. In 1994, he worked as a guest doctor in the Lukas Klinik to gain clinical experience from top medical oncologists in Europe. So Dr. Marolia has a great experience in oncology since 1994. He has been treating wide range of acute as well as chronic ailments across different age groups with homeopathy and an integrative approach to healing. He has immense experience in treating cancer patients in different stages with mistletoe therapy and homeopathy. Many of his patients have been cured and terminal cases received palliative treatment wherein their suffering was minimized and in their last moments of life, they were peaceful. Not to mention the blessing that Dr. Marolia received. This is exactly what I'm bringing to you today. How we all can have that blessing in the last part of our life. And if anyone is suffering from cancer, we need to understand, is there anything more that we can do? So let's proceed with this conversation with Dr. Zubin Marolia, my longtime friend and my colleague from the Homeopathic College that I'm so proud of. Welcome, Dr. Marolia.
Thank you, Dr. Varsha Singh, for the kind words of introduction for today's interview. And I go back many, many years when we were colleagues in the Homeopathic Medical College. And it's nice to know you and to do this interview.
Thank you, Dr. Marolia. Now, all our viewers are waiting to hear what you have to say. So without much ado, I would like to ask you number one question. What do you do? Our viewers are really eager to know. What do you do and what is so different that you do? And what makes you the healer that everyone is talking about? So please let us know your specialty and what you do for your patients.
Fine, Varsha. Once again, a warm namaste and greetings from the Enlightened Clinic. So the question over here is, what do I do in my clinic? So let me go on a small journey with you, Varsha, and with all the listeners. So basically, I am a homeopathic medical practitioner in the city of Mumbai, and I've always believed in listening to my patients, in listening to their life history, in listening to their entire life story. So normally when I see a patient in my clinic, I always leave my chamber and I call the patient to the consulting chamber and I ask one question. And that question is, tell me your story and tell me what is happening in your life. And then we have a full 1.5 hour interview wherein we sit with patients and we listen to their story. I think listening is so very important in medical practice today because listening is a form of communication which builds faith, support, and rapport with the patient. I can tell you numerous examples when listening to a patient has helped a patient unfold his or her own life. And then we try and identify what kind of ailment, what kind of illness the patient is suffering. And then I ask another very important question in my medical practice. When were you last well, wherein your energy levels and your flow of energy in the body was uniform and balanced? And how did you fall ill? This can be a day, this can be a week, this can be many years. So I go on a journey with a patient and I always tell the patient, won't you do your journey and won't you journey your journey with me? For 1.5 hours, we do a full examination of the patient from the head to toe, and then we understand what kind of therapy the patient requires.
So, as I understand from what you are saying, you are not just focusing on the local ailments, you are actually looking at the whole picture, such as the patient as a whole, and you consider every aspect of patient life when you are treating the patient. So you're not just treating eye or ear or kidneys or liver or lung. You are treating the person that you are, who has come seeking treatment from you. And I see that 11 years ago, you discovered this integrative approach, which actually led you to the Integrative Health Department in Memorial Sloan Kettering in New York. Would you like to talk about that experience a little bit?
Definitely. I would like to just highlight my journey with the listeners because I believe every human being, every person in their life has a journey. So I began my career in 1991 after I graduated. I was in the Lukas Klinik and I was attending seminars to learn about anthroposophy and mistletoe therapy. In 94, as you mentioned, I went back to the Lukas Klinik in Switzerland and I learned from guest doctors over there in my work in oncology and mistletoe. And then I began my medical practice in earnest, treating common ailments from cold, flu, migraine, asthma, always trying to find out why the patient has fallen ill. What is the causative factor in a patient that has made the patient suffer from a chronic illness? And it's a journey. So you have to understand every stage of a patient's life. So let me narrate to you a short story. As I mentioned, every patient has a story, and it's the physician's duty to sit and listen to the patient's story. So the first story that we narrate today is the story of a young girl with acne. And she has taken several creams, and as you mentioned, Dr. Varsha, that she's gone to a dermatologist thinking that the acne is a skin problem. And she's taken numerous treatments, numerous medications, and then she comes to me because the acne is now about 6.5 years old. And then I sit with her and I ask her, tell me your story. Why are you having acne? And then she sits down and she's very quiet in the whole interview, Varsha, very quiet. And I gradually ask her about her childhood, about her relationships. And then she says, but doctor, the acne has happened when I attained puberty. Why are you going back to the childhood aspect? So I told her that every stage of your life is important to understand your current illness. And she was shocked. She says, no doctor has ever sat down with me over 1.5 hours to listen to how I feel, to listen how I think. And then she tells me that she has been having issues with her father, wherein she's always been afraid of her father, as to her father scolding her, as to her father reprimanding her at every stage of her life. And she says that even when I used to score marks in my schooling career, my father never had a word of appreciation. And I still today feel a lacuna and a void in my life, the void of a supportive, loving father. So here you see, dear listeners, you see acne and you see the mind-body connection of the fear of the father and lack of love coming from a very important figure of a father. And as we all know, for daughters, father is a very important figure. And so she describes the exact emotional feeling of lack of appreciation from her father, which till today rankles in her conscience. And then I sit down with her and I journey the journey with her and I explain to her that give it time, and we put her on a homeopathic remedy which understands this mind body connection, or what we call the constitution. But the word in Hindi is a much better word, Varsha, and the word is prakriti. You understand the prakriti of a patient, and then we give her a homeopathic remedy, and we make her understand that this is the situation, and this is where the energy flow in her body was blocked, and now she's doing much better, and the acne are nearly 50% better.
That's such a great story. And just to translate, the Prakriti is nature of a person. Is that correct? Am I using the correct word?
Absolutely. Absolutely.
That this is one of the many stories you have. I believe that this is just one of the hundreds of stories that you can share with our viewers. And I know that you have presented at numerous events, not just nationally or statewide, but also internationally. And I think one of your presentation at Johns Hopkins in Baltimore was thoughts of a cancer patient. And that is kind of linking. My next question would be that treating from common ailments such as cold, fever, migraine, acne, how did you focus more and more on cancer therapy, which is such a grave disease that many patients, they continue to receive therapies which are recommended, which is a streamlined therapy. And many countries are open to the therapies such as what you are offering. So can you talk a little bit about how you treated all those patients who had common ailments, at the same time you continued to specialize in Iscador or mistletoe therapy?
Okay, so as you know, I began my journey in mistletoe in 1991. That's about 29 years ago. And as I've been on the journey in my medical practice and I've listened to numerous patients, and very early in my career, I used to take the medical history of a patient, Varsha, in great details. I used to sit with the patient for 1 hour, 2 hours, 2.5 hours, 3 hours, trying to find out what has gone wrong in their lives for them to suffer from cancer. So I find that cancer is not just a local disease. It's not just a tumor in the throat or a breast tumor or a colon tumor. It has begun many years before the actual precipitation of a mass in the breast or in the brain or in the throat. So the current viewpoint of cancer is a loco-regional concept wherein you only look at cancer as a local tumor and you operate the cancer and you remove the tumor and you give chemotherapy and radiation thinking that you have healed the patient. But you have not, because you are giving an immunosuppressive therapy. And those were the questions in my mind, Varsha, which kept on rankling in my mind, that why don't we use an immunostimulant therapy? Why don't we use a therapy that is immunosupportive? And that led me to mistletoe. And as you all know, listeners, mistletoe has been used in cancer treatment in European countries for 100 years. In 1917, this therapy was discovered by an anthroposophical scientist by the name of Dr. Rudolf Steiner, and the first therapy was given in the year 1917. And mistletoe today stands as the most well-documented and well-researched alternative plant therapy for cancer patients. And it acts in 4 ways. Number 1, it is immunostimulant. It helps the immune system to fight the cancer cells. Number 2, it lessens the side effects of chemotherapy and radiation. So you have patients who are under chemotherapy and radiation who come to me, and I advise them whether they would like to take mistletoe as a sole therapy or in adjuvant form with chemotherapy and radiation. So number 2, it lessens the side effects of chemotherapy and radiation. Number 3, it has got certain biological rhythm properties wherein it helps the cancer patient lessen the symptoms and feel better. meaning the weakness in a cancer patient is lesser, there is better appetite, there is better sleep, and the patient feels better, overall well-being. And lastly, it also helps in stabilizing the neuroendocrine function of a cancer patient. The integrative oncology module, a protocol which I use in cancer treatment in India, treating patients all over the world.
So can you briefly give us a little bit information about how many countries, and since 29 years, how many patients approximately that you have reached out to or treated?
Well, that's a very difficult question if you ask me to numerically count the number of patients, but there have been hundreds of patients, cancer patients that I have treated, and I have conducted several webinars. I have a Facebook group called Mistletoe Cancer Therapy. Everyone is welcome to join this group, Varsha. And I have tried to go on a journey with a cancer patient. And over here, I would like to narrate another story, if you allow me, Varsha.
Absolutely.
This is a story of a lady who saw me with a huge swelling in her right leg. Her right leg was like an elephant leg with huge lymphedema, a huge swelling due to advanced ovarian cancer. And she had advanced ovarian cancer with pelvic lymph node metastasis, wherein the entire pelvis was having full of lymph node swellings, which was blocking the blood flow of the leg towards the heart. And she comes to me with her husband. She's been operated. She has taken chemotherapy 2 times, and she's taken radiation also. And she comes with a recurrence. And she comes, Varsha, to me with a stack of reports. And she sits down and she says, this is my biopsy report and this is my histopathology report. And I've been to this big hospital and that big hospital. And then I wait and I look at her and I keep the reports aside and I tell her, tell me your story. And she was shocked, Barsha. She's a doctor asking me a story, what is happening in my life. So she asks me, do you want to tell me my story, what happened in my life? It's too long. I said, fine, I'm here to listen. And she tells me the first line that, doctor, you forget my cancer. You gave me some medicine to work. I want to work. And I want to earn some money because I've spent a huge amount for my cancer treatment, going into lakhs of rupees. She was highly anemic, extremely weak, and she couldn't walk. So she says, you give me some medicine to work. Why do you say this? And she says that all my life I've worked. Even when I was in school, I used to work as a household maid to earn money. Even as a college student, I used to work, and I worked all my life to earn money because I've always faced financial insecurities in my life. From the age of a very tender age group of being a teen. So you can imagine a patient who has struggled with financial insecurities, and that has affected the whole being of the patient, what we call the holistic makeup of the patient, the psycho-neuroendocrine axis, and that particular state needs to be understood. So every physician, whether he treats a common cold or a cancer, has to listen to the patient's story. Whether you have the time or you don't have the time, you have to listen to a patient. And then we gave her a homeopathic remedy which encompasses this particular state of mind of financial insecurity, financial loss, and a hard struggle in life. And we gave her a remedy called Calcarea floor in homeopathy, along with mistletoe therapy, along with my protocol. And she began working 6 weeks after she started mistletoe therapy. She goes to the bank for about half an hour, and then she was with us for about 1.5 years, and then she passed away. But in those 1.5 years, she worked for about 6 months. And that becomes very, very important because I have instilled that same sense of being in her life, what she wanted.
That's actually a moving story because no matter what an individual has diagnosis or whether they are undergoing treatment, there is also a very strong inner desire in every human being that they really want to do something that they really like. So from this story, I gather that you provided her to fulfill her desire to work, even though she was undergoing a treatment and she did have a terminal diagnosis, because of which she passed after 1.5 years. So you connected with this patient and you provided her what she really wanted to do. So that's really a moving story. So Dr. Marolia, going further, I know that you have participated in many research projects, and I know that we do have modern medicine which offers a different mode of therapy, and now this which falls under the umbrella of complementary, alternative, holistic, and integrated. Like there is not a definitive umbrella, but homeopathy and mistletoe, it falls under this umbrella, and it does offer solutions. It does offer an option. So how do you explain, because we have all different kind of practitioners, some who are really skeptic and some who may not understand the concept that you're offering. So what is your approach when you are talking to the scientific groups, and how do you stress your point that yes, this is a therapy that has proven as a palliative therapeutic? I wanted to understand the scientific underpinning of your practice.
Barsha, firstly, I was invited to be a clinical observer in the Department of Integrative Medicine in Memorial Sloan Kettering Cancer Center in New York in 2009. And that was a wonderful experience for me, because that was where the first time I really got to see how you integrate, how Memorial Sloan has been integrating alternative medicine and complementary medicine in mainstream cancer care. So they were using acupuncture, music therapy, guided imagery when you guide your imagination, etc., aerobics, and other therapies together for the well-being of a cancer patient. So when I see a patient, or maybe a cancer patient or a common patient, it's very, very important for me to listen to the whole story and to see where the energy balance in the patient has been lost. What is the causative factor, whether it's an emotional causative factor or a mental causative factor or a physical factor that has made the patient ill. And then we advise homeopathic medicine, mistletoe, and we advise B17, vitamin B17, curcumin, and vitamin C as my protocol for managing their treatment. Now, here comes a very important question. Many a times patients are already undergoing chemotherapy and radiation. So at that time, you have to view different factors in a patient's life and in the patient's treatment as to what is happening. But at every stage, I maintain a scientific documentation of the symptoms of the patient and a holistic documentation. So my documentation always is scientific as well as holistic. And then I combine the two, and then I start the integrative oncology approach.
I think that sounds like you have really followed your protocol, you have a scientific documentation. And if anyone has any question about what you do and how you receive a new patient and how you start their treatment, they always can refer to your website, correct?
Correct. And my email, which I will be forwarding to you.
Wonderful. So, Dr. Marolia, can you talk about the presentation that you did in October of 2019? And as I see here, you talked about the concept in healing your patients, the 3 S's of health at the Truth About Cancer live event, which was held in California. And that had, wait a minute, I have to say this, that it was a live event and the audience of 50,000. That's a wow. So I really want to tell us about this.
Okay, so that's again a story and a journey, Varsha. So let's begin that little journey in my life also. So I was invited to be a part of a series, a documentary series by Mr. Ty Bollinger, who has this entire movement called The Truth About Cancer. And I have spoken and shared my healing experiences in an interview with Ty Bollinger in Bangkok for The Truth About Cancer the eastern part of the world. So the documentary series was to highlight, was to know, was to learn about the alternative medical healing approaches to cancer, and to find out how many alternative medical approaches are there in cancer treatment. So I spoke with Ty Bollinger about in 2019, and then I spoke about my concept in seeing a patient. So my concept in seeing a patient has the three S's, as I said, Varsha. Whenever I see and go on a journey with a patient, I always look at the first S in life. And the first S is the S of suppression. Is the S wherein a patient, a child, a young boy, young girl, a young teenager, or a young worker feels suppressed, feels blocked emotionally, blocked physically. For example, many times you find that a child desires to take up a certain career, but the father says, no, you don't take up this career, you do this career, has got a better approach, etc., etc. Or a young person wants to fall in a relationship with a woman, and it does not materialize. And there is a disappointment in love, a suppression. So suppression can be at any level. It can be a suppression of not able to achieve your ambition or not able to achieve your aspiration, a suppression of love. So the first S I always look for is suppression. And here I'll take you to another story, Varsha. So I saw a patient recently in the city of Mumbai who came to me with a cholangiocarcinoma, who was given chemotherapies till the platelet count had become 16,000. The mass had reduced. So cholangiocarcinoma is a cancer of the bile ducts, and the mass had reduced, but the patient had a platelet count of 16,000. For the listeners, a normal platelet count is about 1,50,000 to about 4 lakhs. So you can imagine that the patient was on the verge of bleeding, and they did not know what to do because the cancer is better, but the platelets have come down to 16,000. So here is a concept which again I would like to highlight, and this concept is a holistic concept by a gentleman by the name of Aaron Antonovsky, and it's the concept of salutogenesis, what is called as the salutogenetic concept, wherein salutogenesis means that the concept of life being structured, meaningful and comprehensible, and you live a full life that is structured. So the platelet count was 16,000, and the patients and the relatives have come to me. And as I mentioned in the interview on Truth About Cancer, I encouraged the whole family to come to me in the clinic. So in a cancer patient, you know how it is in India. We have this patient, the mother, daughter, wife, husband. I said, we all come. And I asked them, I said, what do you want to do? She's having a platelet count of 16,000. And then the patient says that, no, I would like to take mistletoe therapy, and I would like to take mistletoe and homeopathy. And we began her on mistletoe and homeopathy therapies. And today she is normal. Her count is 1,60,000. Her count's built up. But more importantly, she said that I am feeling better and I'm feeling energetic after the homeopathy and mistletoe therapy. So here, the factor of helping the mistletoe, helping the platelet count to increase to a normal level with homeopathy and mistletoe. And in this case, the suppression was that her husband used to never listen to her. In whatever viewpoint that she had in her life, she was always negated. And she says that I always felt a lack of importance in my life by my husband. Number one, suppression. The second S of spontaneity. What is spontaneity? Spontaneity is something wherein there's an impulse and an urge to do something. For example, you see a child and you see a ball on the ground, and the child is running to kick the ball. Correct? I would let the child kick the ball. So go and kick the ball. That's your first spontaneous reaction. But what would happen with an overprotective parent? The parent would step in and say, don't kick the ball. You will damage some windows. You will damage a car window. You will damage this, even though it's an open ground. So you're blocking the spontaneity. So spontaneity is something wherein in a person's life, you feel the impulse and you do it. because that's where the energy is flowing. You follow Varsha, it's the energy flow in the body, and that's what keeps you healthy. And the third S is being a free spirit. You feel free in mind, body, and your spirit, wherein you've lived a full life, you've done whatever you've done in your life, and to feel free. So when I travel the world and I do my adventure sport that I'm fond of, I always encourage my patients, and I do this gesture also, wherein I put my hands apart and I feel the universe. So the three S's: suppression, spontaneity, and the free spirit. You have to identify the three S's. So this is the concept of the three S's in life. And this was what I spoke in the Truth About Cancer documentary series, Eastern Medicine Journey Through Asia. And it was a wonderful experience. I will forward you the link, which you can share with your listeners. This was in April 2019. Once my concept and the video went viral in North America, I was invited to speak about this concept at the live event, the Truth About Cancer live event held in Anaheim, California in October last year. And I again spoke about the three S's of healing, how very important it is that a physician sits down and knows the concept of these three S's. And we had a huge online audience, and it was a wonderful experience for me to come back to the United States and present my work.
So, Dr. Marolia, I'm just speechless, okay? Right now, knowing you, I know that you are in practice for 29 years, but I can proudly say that I know you for 34 years. And knowing you from that time to standing and sitting in front of you today, I'm feeling profoundly proud of what you have done, healing your patients and sending your messages all over the world and getting blessing of many, many patients that you have treated. So I just want to ask you, as our summary of the conversation, what is your message to all our viewers who are watching this and thinking that, how do I address these three S's in my life? So what would you tell all our viewers as your parting message?
Well, I think for all the listeners and all the viewers, I think you have to live life in a free spirited and a spontaneous way. Number one, you need people around you that are positive, that will embrace you, that will love you deeply, and do what you want to do in your life. That's so very important. I'll give you a short story again over here. When I was in Brazil and I finished two conferences and I was in Rio de Janeiro, I am a very, very firm believer in doing adventure sports. I love adventure sports. And in Rio de Janeiro, I did my first experience of hand gliding, wherein you go with an instructor and you go and you do your hand gliding. And it gave me immense joy. So it's very, very important to feel and to do what you want in your life. Number one. Number two, I think you need to, all of you, all the viewers and listeners, have to do some form of exercise, and yoga and pranayam is very, very important in today's stressful lives. Number two. Number three, adequate sleep. Number four, always try and find out a practitioner that has time for you. It's very, very important that your physician has time for you. So an integrative medical approach, wherein you have your consultant, you have your conventional doctor, wherein you do your diagnosis, but at the same time, you also need to have a holistic healing practitioner who will sit down with you and see your mind-body connection, your mind-body axis, and help you with valuable tips in complementary medicine. It may be homeopathy, it may be Ayurveda, it may be a nutrition advice. For example, Varsha, I would like to tell you another very, very small story. Simplicity is the ultimate sophistication. This is a quote by Da Vinci. Simplicity is the ultimate sophistication. And many a times I see patients, and especially women, with obesity. Am I correct, Varsha? Weight issues in patients. And they are on various diets. They've gone to dietitians, they've gone to their endocrinologists, and the endocrinologist spends 5 minutes, 6 minutes with the patient, wherein the hormones we know are linked to how you feel. in the psycho-neuroendocrine axis. The body has an axis, listeners and viewers, called as the psycho-neuroendocrine axis. Psycho means the mind, nerves, and hormones. So how you feel is transmitted to the nerves, is transmitted to the hormones. So they come to me and I tell them something very simple. And I asked my first question to people with weight issues, and they are bowled by this question. My first question is, how fast do you eat your food? How fast do you eat your food? And you will not believe this. There are people who come to me, young people who've been to gastroenterologists, done endoscopies, and the GI doctor has never asked them, how do you eat your food? Do you eat your food in a peaceful, happy, and joyous manner? And how fast do you eat your food? Do you chew your food? That's the first question. And second question is, it's very, very important that when you eat your food, after you eat a meal, to have 10 minutes of rest so that all your digestive processes are stimulated. And then you carry on your day. Whereas you have people that eat food, the husband eats in the bedroom, the child eats in his room, the daughter eats in another room, and the pet eats in another room. We had a family recently, all of them having allergies. And my question was in the family interview, do you eat your meal together? He said, no, we all eat in the individual rooms. Why? So you come together and have one meal together and no digital device when you eat your meal. And lastly, do not keep a long interval between two meals. So these are the common questions. It's a very simple thing. So I always feel simple things in life are very, very important. Again, a very simple advice to people with allergies, nasal allergies, sneezing, cough and cold, bad throats. And my first advice is, of course, in the United States, you do brush your teeth at night. But in the Indian setting, I have to advise them that you have to brush your teeth at night and gargle with water. So you have a physician that is on the conventional mode and have a physician on the holistic mode. Live life truly, live life freely, live life with lots of love and blessings, and all of you will do well.
I hear a lot of integrative approach in your final message. And again, it is not just 3S. Now you have also included a fourth one, which is simplicity. And just following that simple guidelines, everyone can achieve what they are trying to achieve, which is a true sense of feeling well. And you really rightly also recommended that see how much time your physician is spending with you, because it's really important for the treating physician to understand the patients. I believe that our viewers found a different way of thinking after listening to you, and they will take this advice and will go ahead and incorporate in their life. Our viewers also has an opportunity to reach out to you through your website as well as your phone number or email. And I believe that we will be inviting you to listen to your story. I know you have stories after stories to share with us. So I want to thank you for your time, Dr. Marolia and Zubin, as I call you. It's such a great pleasure to listen to you. I can listen to you forever. For now, I would say we will say bye for now, because this is the conclusion of our episode with Dr. Zubin Marolia. We will be back again, another episode of Healthline soon. Don't miss our next episode, because we will have another specialist coming. But today, I really want to thank our internationally known Dr. Zubin Marolia for coming here and sharing his experiences, his expertise, his patient stories, and wonderful advice that he gave to all of us. Thank you, Dr. Marolia.
Thank you, Varsha, for giving me the opportunity. Thanks to Healthline TVAsia for the opportunity. And if I'm able to make even a little difference in living a healthy life, I think my job is done. Thank you very much, and a warm namaste.
I hope you enjoyed this show and enjoyed this episode with Dr. Marolia. And this is your host, Varsha Singh. I'm saying bye for now, but I will be back again with another super specialist talking about many different health information, health preventative guidelines on Healthline TVAsia Telugu channel. Bye for now.